I'm delighted to have with me today Celia Jones, a former registered general nurse who's now retired. Your partner, Brian Bolton, sadly passed away on the 27th of September 2017 at the Royal Gwent Hospital here in Newport under suspicious circumstances. In addition, you were treated unfairly when hospital visits to see Brian were restricted. Can you tell me a bit about yourself and your partner and the events leading up to his tragic death, which was avoidable at the time?
I've lived here for the last 10-15 years with my partner Brian. Brian was a competitive tennis player. I was a nurse. Before that I was a lawyer, and everything was fine. We had dogs, we showed the dogs, but Brian got pneumonia and he had to go to the local hospital, which is called the Royal Gwent Hospital, part of the Aneurin Bevan Health Board. Whilst he was in that hospital, I saw some amazing things that were really bad. And this was in 2016. He fortunately got out of that hospital alive, but I met a nurse who told me that hospitals were better in Romania and I should get him transferred. He was repeatedly asked if he wanted to be resuscitated, as was everybody else in that 6-bedded ward that he was on. He was actually written up, though nobody knew anything about it, for end-of-life drugs. And he was moved into a side room, and when I came in to visit him one evening, he waved at me. "This is great, isn't it? I'm in a side room." And I said, "No, it's not great." And I went to see the nurse there and she said, "Oh, don't worry, I won't start the end-of-life drugs just yet." Well, I was so shocked, I couldn't believe it. I mean, this is a man who was fit and healthy, got pneumonia, was in hospital, got another dose of pneumonia from the hospital, and they were going to kill him off. It was shocking. So basically, because I intervened and his brother intervened, he was moved back into the main ward and he got out of the hospital alive. If I had not intervened, he wouldn't have got out alive. He was eating well, he was sleeping, he could walk. It was shocking. There was a doctor there who I met the next year when he died, was killed, called Martha Scott, who, in my opinion, when I did research, I did a Freedom of Information on that ward. At the time he was there were 35 deaths in 42 days, which I thought was excessive. That was over 2 wards, but it's still huge. It's more than a hospice. I met people from Ireland who'd been called over that their sister had been well, and then they're called over because she's dying. And they're shocked. It's very, very strange. So he escaped and we didn't complain because he was out alive. We lived a normal life for 10 months. We went on holiday to Mallorca, we went to Crufts, we showed the dogs, normal life. And then suddenly in August, Brian had pains in the ribs. And these pains in the ribs, were intermittent, but we did go to a private hospital who referred us to the hospital that he'd actually been in before. So we went to this hospital casualty area and he was referred for a CT scan and sent home. So we had the CT scan, and I can date it now, that was the 25th of August. And we were told 2 weeks later that he may have a hiatus hernia, but apart from that, there was no abnormality. He may be referred to the gastroenterologist and he may have an endoscopy, but everything was may. In the meantime, it said, "Stay well." So that was a good report. Less than 2 weeks later, his saturations became low and he was tired, and that was about it really. I did call an ambulance because the saturations were quite low, and he got taken to the Royal Gwent Hospital again. He didn't want to stay there. He was admitted to a ward on the Monday, the 18th of September, and I thought, well, this is lot nicer than the year before. That week, Monday, Tuesday, Wednesday, Thursday, Friday, nothing to my way of thinking that happened was untoward. Apart from the fact that he had an outpatient appointment on the 20th, which he wasn't allowed to keep, even though it was in the same hospital. And that was presumably to discuss the scan. Fast forward to the 25th of September, I walk onto the ward. I go and see Brian straight away. It was 2 o'clock, I can remember. And he said, "You'll never guess who's here." And I said, "No." He said, "Martha Scott, the same doctor as last year." And she said, "I never thought I'd see you again." And he didn't take that very well, and I didn't take it very well. But within minutes, I was called into an office. "The doctor will see you now." I was quite surprised about that. I was met by 4 people. A woman with long hair, then this Martha Scott, Nicola Marsh, the ward sister, and John Tresize, who'd appeared from nowhere. He was a ward manager. And I was accused of giving Brian unprescribed furosemide. He'd been admitted with a chest infection and low sodium, and they were blaming me for the low sodium. Now, I was then banned from the ward for only 2 hours per week. I could come in the next day at 2 o'clock, and I had to leave with this woman, Nicola Marsh. Whenever the other day was, I don't know, because I never got in again. I wrote an email. I was frightened for his life. I was worried because this was so outrageous. It was strange behaviour. I mean, where did they get this unprescribed drug from? I couldn't give an unprescribed drug because how would I have got it? It would have had to have been prescribed, and Brian took his own medication, and it was a prescribed medication. So I can't remember much about that day after that. It was like a punch below the belt. It really was. And Brian was upset. I wasn't going to go in the next day because I was scared. They were such bullies. They were like thugs. And I did go in because he begged me to go in. And I had to stay an hour. I had to watch this woman, Nicola Marsh, slap him. When I say slap, she went like this on the wrist because she threw his water away and he complained. He'd been systematically dehydrated. He was allowed 500 mils a day. I had to leave at 3 o'clock, I remember that. And on the way down in the lift, she said something to me. She said dolls. I didn't know what she was talking about. When I got home, I Googled. It meant deprivation of liberty. And I quickly rang a solicitor who dealt with this sort of thing. And he said, "Don't worry, they can't do that to him. If you can make a decision, they can't do that." And bearing in mind, Brian is completely, compos mentis, sane, wanting to go home. It just seems unbelievable. But this is what happens. The dolls and the do not resuscitate, and then death. So it was arranged that this solicitor would go in the next day in the afternoon because he said they can't possibly do that. He was going to be local. I was not supposed to go in that day because they were putting things in place. I had phone calls from Brian who said, "Get me out of this hospital, I want to come home." And I went out with friends for lunch because they knew I was distressed. He also phoned again at 3. And I was speaking to the Community Health Council who were trying to intervene about what was going on. I was just about to phone the ward to see how his afternoon had gone, when I got a phone call to come in because he was acutely ill. I phoned a friend. I said, "Meet me there." And on the way in, I rang and they said, the nurse who answered the phone, I think her name was Rebecca, she said, "Oh, you're too late, he's dead now." So I nearly went into the back of a bus. I mean, I was just so unbelievably shocked. And I parked, I went up to the ward, and there he was, dead in the middle of a ward. When I say in the middle of a ward, he had curtains barely drawn around him. The 5 other patients had visitors, and he was there looking very dead. I still get flashbacks to this day of post-traumatic stress. So I said, well, you know, what happened? Did he choke? Oh, no. He was absolutely fine. He was walking around the ward. He had a good supper, lay on the bed and died. That was a complete and utter lie, as I found out later. So the next day I'm told to collect the death certificate. And I'm rung by somebody else who gives me a completely different story, that he'd gone downhill at 4 o'clock and she said, oh, well, it's probably just as well. Unbelievable. I made a complaint. I said that you've killed him. Well, the hospital did their own investigation and I had to wait 7 months for that. My assembly member got involved because it was so long. They said I wasn't next of kin. I was supposed to be making the funeral arrangements after Brian died. Brian had a brother, but they were estranged. But the hospital demoted me from next of kin, and Brian's brother became next of kin, even though I was the name next of kin. The other thing I wanted to mention about the Doles form is that there's an issue still going on with my MP, because the Doles form is about me. It says that the reason the Doles was put in place, I had given unprescribed furosemide. I suddenly become not a partner, I'm a friend. I have many statuses. I'm even a neighbour in some of the notes. I mean, it's berserk, but I want that altered. I've written to the health board. I want redress and rectification of the notes, because that's about me. I'm identifiable. They also said that Brian referred to me. Well, he was vulnerable. I think he was terrified being in that hospital. I know he was the year before. I mean, it kind of worries me that on that last day, he didn't know he was going to die on that 27th. Why was he ringing me for me to get him out of the hospital? He really wanted me to come and pick him up. Did he feel some sort of danger? You get a sixth sense. I saw that woman. She was vile. She said, oh, he's confused. I said, no, he's not confused. And then she retracted that and she said, well, it comes and goes. Well, it didn't come and go at all, because Brian actually said to me when I came in that day on Tuesday, the day before he died, he said, we haven't got long. Now, he meant the fact that we'd only got an hour. And I looked at him and I thought, you don't look very well. You look a bit yellow. You know, those words, we haven't got long. He didn't know he was going to be, die the next day. I mean, that resonates with me now. I want his story told.
What do you believe was the motive behind the hospital appointing Brian's estranged brother as the next of kin?
They had to get Brian's brother into the hospital so they could speak to him. Because Brian's brother and I, although Brian didn't get on with his brother, I got on with his brother. Not particularly well, but we were speaking and I got taken out of making the funeral arrangements. Now, I know from after the hospital report, which was complete whitewash, as I said, the only alternative you've got is to go to the Public Service Ombudsman, which I went to, and they investigated for 18 months. And what really drove me on was the unprescribed furosemide. I was a nurse and I had been a lawyer. That, to me, they were accusing me, although they didn't seem to realise, to do something like that in my book is a criminal offence. And why would they do it? What was the motive? Even now, can't see the motive, apart from the fact that I think they wanted to get me out of the way quickly, so that they could administer end-of-life drugs. I have actually no proof that end-of-life drugs were given on that Wednesday, but they were written up. Diamorphine and midazolam were written up. And that woman, Dr. Martha Scott, who has a kind of predilection for prescribing these things had come back on the ward. Everything became clearer when I received the hospital notes that they tried to stop me from getting in August 2018. I found that Brian was admitted on the 18th of September. On the 20th of September, a do not resuscitate order had been placed on Brian by another doctor who has been named in other people's deaths, that he was not to be resuscitated because he was confused and had no relatives. Now, this was directly contradictory to the fact that another doctor had found that he had capacity to discharge himself against medical advice, because we can get you better, and I actually persuaded him to stay. I then found a Dole's form, which again was completely false, in the fact that the only thing on the sheet, there were 6 pages, was true, was his name. He'd suddenly developed a diagnosis of dementia and had been referred to a memory clinic. And repeatedly, he had no relatives, which is a complete lie. The relatives were listed. So it was all brought out by the Public Service Ombudsman. I went to NHS Wales, I got the prescriptions. So I could prove. When I looked at the medication charts, it was clear that the hospital were giving this drug themselves and had given it. So again, this is a real puzzle. Are they really so confused, or were they trying to blame me for something, and why? The only conclusion, as I said, that I can come to is that they just wanted me out of the way. The Ombudsman did a lot of investigating. I didn't know about the tumour. I knew that Brian had got cancer because Brian's brother had insisted on a post-mortem. The post-mortem itself was kind of flawed because the doctor said he died on a different day to the time that he did die, and it seemed a bit sort of hodgepodge. But I asked for the pathology report. The coroner really didn't bother with me at all, but I did get the pathology report, and on the pathology report he had a tumour the size of a tennis ball, and that was on the scan. So the Ombudsman then stopped the investigation. We had a huge meeting, all taped, and they said, we're going to have to reinvestigate because this is very serious. So they went to an expert in the Christie Hospital in Manchester. I went to an expert down here who gave his services freely, and they both came back to the same conclusion, that this tumour was completely obvious. The Ombudsman's expert said that he should have had a stent put in immediately to stop any obvious obstruction that was going to happen, because this chest infection was not a chest infection, it was aspiration pneumonia from the tumour. I did know, but I found out much later because the hospital hid it, that Brian had been given an injection of something in error. Now, I don't know whether it was a major tranquiliser to quieten him down, i.e. because he wanted to go home, or whether it was a lethal injection. But he was given an injection at 16:25 and he was dead 90 minutes later. Now, to me, that is a major problem. The forensic expert from Muir, Dr. Mark Bergin, they do court cases. They said that it was very significant, the temporal association with the injection and his death. But the hospital have failed to give me the controlled drugs book site of it. They have now said they will acknowledge anything I ask them, but they won't actually answer the questions. So the findings of the Ombudsman's report were that there were serious failings, breaches of human rights, both to Brian and to myself, and they took Brian's voice. He had no voice in this. They held that the DOLS, this deprivation of liberty, had been incorrectly implemented. That's all written down. It's not in dispute. I actually go further and say it was illegally implemented because they hadn't followed the protocol, the procedure. They also held that they breached my human rights in accusing me of giving Brian unprescribed furosemide and banning me from being a visitor at, very restrictive times, because the protocol is that if somebody did something, you would warn them verbally, then you would write to them, and then you would maybe set up a contract. But I was just told to go. No right of appeal at all. And this Doles, there's a right of appeal against the Doles. Brian didn't have a right of appeal because he didn't know about the Doles. Nobody knew about the Doles after he was dead. I mean, it's very shocking. Totally, his human rights were taken. He would have been better off in Guantanamo Bay, I think. He would have had more human rights. After the Ombudsman's report came out, they had recommendations to put in place, that they have to do a proper capacity test, because if you're going to put a Doles on someone, you have to do a capacity test. You have to have a best interest meeting. You have to inform people. You have to inform the person. None of that happened. They have not, to this day, put in a template as the Ombudsman instructed for a capacity test.
The hospital's health board did not consider you a suitable advocate for Brian. On top of that, a do not attempt CPR was also placed on Brian, along with an improper implementation of a deprivation of liberty safeguards process and authorization, also known as DOLS. In order to implement a DOLS, a mental capacity assessment must be made. Can you explain what this assessment or test entailed in Brian's case?
You have to be able to make a decision. You have to retain information and give the person an answer. People are allowed to make unwise decisions. You might be asked a question and say, well, look, it's safe to walk across the road. Well, that's your opinion, and you're allowed to have that opinion. It may not be safe, but you're prepared to take that chance. So, yeah, he wasn't given any chance at all. The Doles took away his freedom. If I had gone into the hospital with somebody to take him away, we could have been arrested. It's a moot point because the Doles was illegal, but I did see some lady who took her mother from a care home recently last summer, and she was arrested. It was on Sky News. I have dug further and further into this health board. There are serious harms, serious failings, avoidable deaths happening every 6 weeks. So I've called upon the Welsh Government. I want a public inquiry into that hospital. People are scared to go there. There's been a case recently where a poor child of 4 died of sepsis. They were just turned away. The university hospital, she was taken there, but they couldn't save her. It was too late.
Where are you now in terms of what has been investigated and established in Brian's death?
We know now he would have died because of the tumour, but he wouldn't have died then. He could have gone home and he could have had maybe months, weeks, months, we don't know how long. He could have had palliative care if it wasn't curative. But if that injection killed him, as the forensic expert thinks it did, there should have been an inquest. There wasn't one. He could have died with dignity.
I understand that you were able to view Brian's hospital health records. What was your reaction to the contents of his records?
I was stunned when I looked at the notes because there were so many falsified sheets. There were 3 typewritten sheets placed in the notes. And one of them was done by the ward sister, Nicola Marsh. And she said that I made a phone call to the ward saying that I've done this. I've given him unprescribed furosemide. I believe that was added after his death. I've done so much research. I've done SARs, FOIs. Brian's notes were accessed 700 times after his death. Now, all I can say is a shame that they weren't looked at before his death, because he may not have died. Her typewritten sheets, the Ombudsman's called this out. They said typewritten sheets should never be put in notes. it directly contradicts the handwritten contemporaneous notes of that day, which says that I'm with Brian. He's sitting in a chair, not in bed, with family. Her description is that he's lying in bed, prostrate. Well, it's just not true. I reported the 2 nurses to the NMC who did the dolls because it was illegal, and their findings were they haven't punished them at all. They've let them get away with it, and they're now able to do that to other people. But the NMC found that what they did put me at significant risk of serious emotional harm, which I think is quite strong stuff. So this is the NHS, this is the Royal Gwent Hospital, this is the Aneurin Bevan Health Board. And very recently the BBC exposed the Aneurin Bevan Health Board for doctors being scared to go to work because it's an accident waiting to happen. Well, the accidents have already happened.
Have the hospital admitted to administering a larger than prescribed dose of a diuretic drug? Did they say this was given in error? Do you know what this drug was?
The hospital know that if the injection killed him, it's manslaughter, it's gross negligence manslaughter. There's no record of a mistake. They admit the medication error, but there's no serious incident report about a medication error. Well, there should be.
The end-of-life cocktail of drugs, diamorphine and midazolam, were written on the drug charts. Does that mean that they were definitely administered?
I can only be left to think that I was got out of the way. The intention was that he would be given diamorphine and midazolam at some point, and obviously with the tumour that he had that they didn't know about, that would undoubtedly have killed him. It would kill healthy people. Midazolam kills healthy people.
Significant elements of Brian's care were found to be far below the expected standard of an NHS hospital, as admitted by the hospital's health board. The catalogue of errors paint a picture of something far more sinister than negligence. There seems to be something deliberate about the actions, especially when effort has been made to conceal the truth. Why might such a series of actions with awful consequences for your partner have been taken?
Well, Brian would have cost the state money. He had a pension. He possibly had another 10, 12 years left to live, easily. To me, being a nurse, I've never seen anything like this in my life, ever. And I've worked in this area, but not that hospital. But I've worked in Australia, and I was totally shocked. I couldn't believe what was going on. It seems to be a culture at the moment of getting rid of the weak and the elderly. I mean, he wasn't old, he was 69, but that could be elderly to some.
The so-called pandemic has really shone a light on the way the health and social care sector treats the most vulnerable in our society. It's become apparent that euthanasia, despite being illegal in the UK, has been rife even prior to the so-called pandemic. What are your thoughts on the way authorities dealt with the elderly during the COVID-19 hysteria?
I think it's been handled really badly. I think it's been used to get rid of old people, the weak and the vulnerable. I have a friend who is a nursing home manager. She manages 10 nursing homes, and she said that agency nurses were brought in to give end-of-life drugs. She complained, and it wasn't done in the second wave, but that is local in Wales. It's been happening more and more with this pandemic, but it's been going on for years before. But now it's sort of mass murder.
A number of child survivors of the Holocaust have described striking parallels between what they witnessed during the Nazi reign of terror and COVID policies being enacted today by governments around the globe. The Nazi reign of terror began with lethal drugs being administered to those deemed weak and vulnerable, including the elderly and disabled. Are you concerned by the threat posed by the global heirs of the Nazis infected with their eugenics?
I can't believe how many people have died who were weak and vulnerable. But were they weak and vulnerable? They were deemed to be weak and vulnerable by the state.
I understand that there have been some strains between you and Brian's brother. Can you tell us how that might have been precipitated?
Brian and his brother didn't get on. The fact that this Dr. Martha Scott, it's very strong in the Ombudsman's report. The Ombudsman said that Martha Scott misled the coroner. She's initialised it in the report. Misled the coroner because she didn't tell them about their medication mistake. She actually did tell the coroner that I'd given him unprescribed furosemide, which doesn't put me in a very good light. But furosemide would never kill somebody, but I didn't do it anyway. She also told Brian's brother, and from that day on, Brian's brother and I haven't spoken, and I didn't know why. So I was told that I couldn't pick up the death certificate on the Thursday, and I realised they said that it had to be a blood relative, which is utter rubbish actually. But that was the only way of getting Brian's brother in so that they try and divide families. They divided us. Because obviously she's a doctor, they're going to believe her.
Once again, it appears to me that this may well have been a planned operation to end the life of your partner when you consider the numbers of staff that were involved in the errors and the way in which the Hospital Health Board defended the actions of its staff. What are your thoughts about the involvement of particular staff in your partner's death?
The three of them, Martha Scott, Nicola Marsh and John Trezise. Nicola Marsh was probably used because I'd never seen her, but I did see John Trezise and Martha Scott, who were in charge of the ward the year before and who were giving out end-of-life drugs or responsible for that ward. It doesn't bear thinking about when you think that the action of getting rid of me was premeditated. There was no real reason. They didn't check up. If they checked up, they would have seen that the furosemide was prescribed. When I actually went through the boxes of furosemide, which I kept for a court case, you could see he'd barely taken any. My cousin is a doctor. He's a retired GP. When I told him, Brian's in hospital, he's got low sodium and a chest infection, he said, cancer. He said low sodium is a red flag for cancer. But they couldn't think about it. I think they knew all along.
Do you think that anyone in the hospital knew about the tumour earlier than they let on?
I don't know. It's strange. I haven't got the complete answers yet. I may never get them.
In terms of a public inquiry for you and others who have suffered similar deaths of loved ones at the Royal Gwent Hospital, are you any closer to having one granted?
I've got people who come to me on a regular basis with concerns. Somebody's got their father in hospital now. Somebody else, mother died, same doctor. There are many, many people who are concerned. The Assembly member has actually asked and written to the Health Minister that she wants a public inquiry. She thinks it meets the bar. She's asking for my case. I actually think the whole hospital needs a public inquiry.
What would you say to other people who may one day have relatives or close family members that could potentially fall ill and be in need of hospital treatment and care?
At the moment, I'd say stay out of hospital if you possibly can. Stay as well as you can.